Om Swastiastu. Good morning, doctor. We are from small group discussion B2. Today we will present our student project with the title Microhematocrit. Before we start our presentation, we will introduce ourselves. Next slide. Member's name and the student numbers can be seen on the slide. Okay, now we will start our presentation from the first chapter, Introduction.
My name is Niputu Apsari with the last three digit of my student number is 058. I will explain about the background of our student project. In the process of diagnosing disease, one of them is assessed by a complete blood examination. Blood tests are carried out to detect the body's response to the treatment and find out if a patient has anemia. A hematocrit test, also known as a peak cell volume, can be done by two methods, namely macrohematocrit method and microhematocrit methods. And in our student project, now we will explain more about microhematocrit method.
My name is Teresa Vitania Amares with the last three digits of my student number is 060. And I'm going to explain about the problem formulation. The first one is what is the definition of microhematocrit method? The second one is how is the procedure of microhematocrit method? The third one is what interfering factors affect the microhematocrit method? The fourth one is what are the advantages and disadvantages of using microhematocrit method? The fifth one is what are the applications of microhematocrit method? And the last one is how is the comparison between microhematocrit method and other methods? The objectives of the student project you can see on the screen.
Noves Pedoman, and you can call me Vyasa, and my last three digit number is 051. So for the benefits, there are two benefits in this paper: theoretical benefit and practical benefit. And for the benefit, you can see in the screen. Thank you.
My name is Nilo Kadet Asri Bintari with the last three digits of my student number are 063. Today, I would like to present about the definition about microhematocrit method. The microhematocrit method is a technique for checking the hematocrit levels using a capillary tube and centrifugation technique with a spin speed of 15,000 rpm for 5 minutes. The availability of many tools, the level of precision that can be accepted, and the relatively simple tools used have made the microhematocrit method as the standard for determining hematocrit levels.
My name is Dina Ria Sakura Kirani, and the last three digits of my student number is 055. And now I will present to you about the microhematocrit procedure. The microhematocrit is using a small tube called capillary tube. Therefore, there are some steps we need to do for the procedure. Start with filling about a quarter part of the capillary tube with blood. Seal the end part with wax or plasticine. Place the tube in the microhematocrit centrifuge and centrifuge at 11,000 to 12,000 rpm for 4 until 5 minutes. For the reading process, we need to do some steps, such as place the capillary tube on the microhematocrit scale. Make sure to place the scale line that shows the number 0 above the sealing wax. Adjust the scale line between the Buffy code and the HCT. Read the RBC level without includes the Buffy code and the sealing wax. Result of the PZV is stated in the form of percentage.
My name is Kadek Bintang Setia Putri with my last two digit of my student number is 056, and I will explain about the interfering factor. The first one is a trapped plasma, which may give a higher hematocrit rate. The next one is a disorder, which include sickle cell anemia, macrocytic anemia, hypochromic anemia, spherocytosis, and thalassemia. The next one is a newborn babies, and newborn baby shows a higher hematocrit rate because of the fetal hemoglobin. The next one is a high altitude, which higher hematocrit rate was found in an inhabitant of high altitude. Next slide. The next one is gender, which hematocrit rate in females is lower than the males one. And the last one is a blood sources, which the hematocrit or hemoglobin concentration in venous blood are smaller in the capillary blood.
My name is Nikata Tomnikani Yotami, and my last year number is 048, and today I will explain to you about the advantages of the microhematocrit. The microhematocrit method takes a short amount of time to do the procedures compared to macrohematocrit. To do the centrifuge, the microhematocrit method only takes for about 5 minutes. The microhematocrit method uses a small heparin capillary tube since it requires less amount of blood. A single prick blood is enough to do the inspection. As the blood sample needed is little, It is very beneficial for the mass survey. Also, because of the smaller tube, it is very convenient to clean. The microhematocrit method is low price and the approach is simple for counting the PVC. The technique is simple, precise, reproducible, and the testing time is short.
I will present the disadvantages of microhematocrit. So first, it is time consuming compared of the 3-fold converted, especially for the pregnant woman, because its utilization is in under-sourced research made to be constrained because it requires a specialized centrifuge and a depend of capillary tube. Second, careful preparation required of sealing of capillaries because it is for avoiding the inaccuracy of determination. So the capillary tube sealing for the microhematocrit technique needs to be tight to avoid any leaks and to prevent inaccurate findings. So the centrifuge machine also do not to be open.
My name is Sigede Pramaditya Waisaputra. The last 3 digits of my student numbers are 045. Now I will explain about the applications of microhematocrit. Microhematocrit is one of the most common ways to evaluate and measure someone's hematocrit. It is famous for its simplicity and efficiency to know someone's hematocrit level because it doesn't need much time to do it and not many samples are used. Next slide, please. Polycythemia is a condition where the hemoglobin or hematocrit level on someone is increasing above the normal range. On the other hand, anemia is the decreased level of hematocrit or hemoglobin or red blood cell count. Both of these diseases could be monitored by microhematocrit with other diagnosis techniques such as peripheral blood check to mutation screening and measurement of serum erythropoietin for polycythemia.
My name is Putu Sanggitani Rajanari, and the last 3 digits of my student number are 049. Okay, so here I'm going to explain about the comparison between microhematocrit method with another method such as automatic method. So the first one is working principle. The principle of microhematocrit method is to perform centrifugation in high speed. It is 16,000 RPM within 5 minutes. While the autoanalyzer method, the principle used is flow cytometry that flow the blood cell one by one to the apertura and get shot by light beam to turn into an impulse and being calculated. The second one is the material. Microhematocrit method need materials such as hematocrit reader, microhematocrit centrifuge, capillary hematocrit tube, Soflex, and blood ADTA. While automatic method needs 3 detector blocks reagent, blood samples, and automatic instruments such as hematology analyzer. The third one is error factor. Microhematocrit method can get inaccurate when capillary tubes that are not perfectly sealed, inappropriate centrifugation time, some diseases such as anemia, thalassemia, can cause plasma to be trapped in erythrocyte. Automatic method get inaccurate when 2 cells count as 1 cell, recirculation of blood cells, and the presence of orange particles. And the last one is calculation result. Based on research conducted by Hawassa University College of Medicine and Health Science in Ethiopia, hematocrit value using the microhematocrit method was slightly higher than the autoanalyzer method, with a difference of about 1 until 3%. Automatic method has not been able to replace the role of the microhematocrit is the conclusion of the research conducted by the Hawassa University College of Medicine and Health Science in Ethiopia.
My name is Iputu Pranadia Vidasagara, with the last 3 digits of my student number are 059. And now I will explain about the comparison between microhematocrit method and macrohematocrit method. So in the macrohematocrit method, the material used is venous blood with anticoagulants, and the tools used include Winthrop tubes, centrifuges, and Pasteur pipettes or syringes. The working principle of this method is to centrifuge anticoagulate blood in a Winthrop tube at a speed of 3000 rpm for 30 minutes, so that red blood cells solidify below the tube and height of the red cell volume are measured and read as PCV or hematocrit values expressed as percentage. Meanwhile, microhematocrit has some differences with macrohematocrit. In terms of tools and material use, this method can use capillary blood or venous blood as material and can use 2 types of capillary pipettes.
I will continue the presentation with conclusion. So the conclusion of this student project is microhematocrit method is one of the methods to check hematocrit using a capillary tube. When performing the microhematocrit method, it is necessary to pay attention to the necessary tools, materials, and proper procedures to prevent obtaining false results. Okay, that's all from our presentation. Thank you for listening, and we are sorry if there are mistakes during our presentation. We close this presentation with Parma Santi. Om Santi 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 Om.